Tensions rise over Nancy Pelosi's expected visit to Taiwan, with China warning of serious consequences. And company executives are put on notice as Singapore addresses a recent spate of workplace fatalities.
Many of these accidents could have been prevented with basic safety precautions. Now, if you look at the 31 fatalities this year, 7 involved falling from heights, making it the top cause for fatalities this year.
Hello, you're watching The Big Story with me, Chow Su An. Subscribe to the Straits Times channel to stay up to date with our live news updates. Now, US House Speaker Nancy Pelosi is set to arrive in Taiwan tonight, and she will meet President Tsai Ing-wen on Wednesday, according to multiple reports. Mrs Pelosi is third highest in the US's chain of command after the President and Vice President. Now, if her visit goes ahead, it will likely prompt an angry response from China, which views Taiwan as part of its territory. Already this morning, several Chinese warplanes reportedly flew close to the median line dividing the Taiwan Strait, amid tensions over her potential visit. A long-standing critic of Beijing, Mrs Pelosi has been vocal on issues ranging from the 1989 Tiananmen Square crackdown to the country's human rights record.
Definitely, such a visit undermines the One China principle, undermines China's sovereignty and territorial integrity. It also undermines the peace and the stability in the Taiwan Strait. So if such a visit happens, it will also undermine the relationship between China and the United States.
If the Speaker does decide to visit and China tries to create some kind of crisis or otherwise escalate tensions, that would be entirely on Beijing. We are looking for them, in the event she decides to visit, to act responsibly and not to engage in any escalation going forward.
Earlier today, Mrs Pelosi arrived in Malaysia as part of a scheduled tour of Asia. She began her trip in Singapore on Monday and has said she will also go to South Korea and Japan. Our coverage continues on straitstimes.com and on our social media platforms. Hit subscribe to stay informed and activate the bell icon on YouTube to catch live news updates. Now, moving on to today's Parliament proceedings. By 2045, temperatures here in Singapore could hit 40 degrees Celsius on some days. This is due to a warming planet compounded by our urban environment releasing trapped heat from buildings, roads and vehicles. But Sustainability and Environment Minister Grace Fu says Singapore is bracing for it in 3 ways. First, by further understanding the impact that intense heat has on the country and ourselves. Second, reviewing efforts to strengthen people's resilience to heat. And lastly, by coming up with effective cooling strategies. Here's Minister Fu elaborating on this third prong, which she breaks up into 2 categories.
First, measures to promote cooling in our urban environment, such as through urban planning and building guidelines, infusing more greenery and scaling up the use of cool materials on buildings. Second, measures to reduce the heat generated from human activities, such as from our homes, our roads, and our industries. These include, for example, efforts under the Singapore Green Plan to electrify our vehicle population and to increase the energy efficiency of industrial, commercial, and residential buildings.
And among the government's plans to mitigate heat in homes and residential areas, in new towns and estates, HDB is conducting modelling to site new flats, design building facades and refine building layouts in order to harness existing wind corridors and optimize wind flow. As for existing towns, HDB is running a pilot study on cool paint, which could reduce ambient temperatures by up to 2 degrees Celsius. The study is expected to be completed in 2024.
Based on the study outcomes, HDB will consider extending the use of cool paint to more estates. Under the HDB Green Town program, which covers all existing HDB towns. HDB is introducing greenery to the top decks of selected multi-story car parks in the form of urban farms, community gardens, and rooftop greenery, using the prefabricated extensive green, or PEG, roof tray system based on the suitability of those car parks. These efforts also aim to reduce ambient temperature.
Transport Minister S. Iswaran says Changi Airport is leading Asia-Pacific's post-pandemic recovery, with its weekly passenger traffic hitting 55% of pre-COVID-19 levels in the first week of July, and international connections at 65% of what it had been before the pandemic.
The pattern of recovery across the world has been uneven. Air hubs in regions such as Europe, North America, and the Middle East, which reopened their borders earlier, have seen a faster recovery. International passenger traffic at the Middle Eastern air hubs of Dubai, Doha, and Istanbul had recovered to more than 90% of their pre-COVID levels even before June 2022. The connectivity at these hubs in terms of international city links is also at 90% or more of pre-COVID levels as of June 2022. Within the Asia-Pacific region, Changi is leading the recovery. As of June, compared to the major Asia-Pacific air hubs such as Incheon, Hong Kong, and Bangkok, Changi is ahead in terms of both international passenger traffic and city links vis-à-vis pre-COVID levels.
Senior Parliamentary Secretary for Health, Rahayu Mazam, says the proportion of nurses in public hospitals who resigned reached a 5-year high last year at 7.4%. As you can see, aside from a drop in 2020, the resignation rate for local nurses has been rising since 2017. And Ms. Rahayu says the increase was even greater for foreign nurses, which she attributed to more intense international competition. Now, despite this, the typical nurse-to-bed ratio in public acute hospitals hasn't changed significantly. In general wards, the ratio is 1 nurse for every 4 to 5 beds, 1 nurse for every patient in the ICU, and could be even higher for more complex cases. And while Ms. Rahayu didn't reveal salary comparisons between the public and private sectors, she gave a range of how much staff nurses and senior staff nurses earn, and both have been on the up since 2017. Last year, the median annual salary for staff nurses was $46,300 to $58,500, and $71,200 to $87,600 for senior staff nurses. Ms. Rahayu says it takes an average of 4 to 6 years for a fresh graduate to become a senior staff nurse. The key issue remains, though, how can Singapore better retain the services of our nurses?
Our strategy to stabilize the nursing workforce covers several key aspects. These include reviewing the scope of work that nurses are doing to enable them to spend more time on direct patient care. Equally important is to ensure remunerations are competitive, locally and also internationally. On reviewing the scope of work, our public healthcare institutions adopt a multi-pronged approach to reduce the administrative workload for nurses and enable nurses to focus on patient care. This includes streamlining care processes and deploying dedicated administrative and support care to assist nurses. Over time, we have also introduced innovations in automation, technology, robotics, and AI-enabled technology to assist nurses and healthcare staff to ease the load of non-clinical and administrative tasks.
Workplace fatalities have been on the rise, with 31 so far this year, the most over the same period since 2016. In Parliament yesterday, the Manpower Ministry announced new measures to prevent such occurrences. And I speak with Senior Minister of State for Manpower, Zaki Mohammed, on what's being done to improve safety for workers.
Many of the fatalities and workplace injuries occurred due to basic safety lapses such as inadequate control measures and lack of compliance with proper work methods. And to me, this is very worrying and I would say even disturbing, because we need to really tackle these issues because lives are at stake. Many of these accidents could have been prevented with basic safety precautions. Now, if you look at the 31 fatalities this year, 7 involved falling from heights, making it the top cause for fatalities this year. So give you one example. A worker was preparing for cleaning works on the rooftop of a factory when he fell through a skylight and landed 9.5 meters below on the factory floor. So he was not wearing any fall arrest equipment despite being tasked to work on the roof. Now that's, I think, that's very clear cut. In another instance, a renovation company owner fell through a false ceiling board and landed about 4 meters below. So if we look at both, situations, there were clearly poor control measures and a lack of basic safety precautions that suggest that, the companies did not take, safety seriously. Risk assessments were not done, proper equipment were not used, and measures were not taken on site. And as you can see, just like Minister Tan Sileng said, these workers or even the company director were all, experienced folks. They are not new to workplace safety or the environment. So this is why we are rolling out measures that will compel company senior management to take workplace safety and health more seriously. And I think this is where I spoke last night at the adjournment motion that we will introduce the approved code of practice or ACOP for company directors' workplace safety and health duties, which will be gazetting later this year. And this, will make sure, and with ACOP, I think corporate leaders and boards of directors will be guided in their workplace safety and health responsibilities. So this, in the event of a Wish Act offense, the courts will consider the ACOP when assessing the capability of company leaders and its board, and they can and will be prosecuted if found to be culpable for safety lapses. So I think we are putting a lot more measures in place to make sure that companies are aligned with what needs to be done for workplace safety. In addition, we're talking about how we will disqualify unsafe firms from public sector projects. So if a company has a poor safety track record, they will be barred from public sector projects for a period of time. At the same time, we'll also be reviewing the demerit point system to ensure that it's effective in penalizing firms for safety breaches. So unsafe contractors that accumulate many points can be debarred from employing work permit holders for a period of time.
So, SMS Zaki, there seems to be a rush to complete projects delayed by the pandemic. How will this affect the safety of the workers? And we understand, as you mentioned, that MOM is looking to take a preemptive stance against these workplace-related deaths and injuries. So what are some other preventative measures that the ministry is looking to take or considering in the near future, particularly in what seems to be a rush to complete projects?
Well, I would say this. The safety and health of workers must take precedence over the completion of projects. I can empathize with employers whose projects or commitments are delayed due to the pandemic. However, we're going to ask ourselves, right? How much is a life worth? How much is your hand, thumb, foot, a limb worth? So we have a duty of care for our workers. So I can assure you that workplace accidents will result in even more severe project delays, and there will be consequences to those who are negligent. But there has to be a balance between business interests and the safety of our workers. So the Ministry of Manpower is looking at upstream measures to strengthen companies' workplace safety and health ownership, how we can help raise awareness on workplace safety and health, and help companies build capabilities to manage safety risks so that more companies want to be equipped to do it well, and then certainly do more for workplace safety. So as I mentioned, we need to strengthen top management's commitment to improve workplace safety and health because they set the culture, they set the tone, and they allocate resources within the company to shape the practices on the ground. But we also want to help build companies' capabilities to manage their own workplace safety risks. So we are considering institutionalizing a few things, such as pre-start assessments to identify danger spots, such as especially for potentially hazardous work conditions, so that companies can put in place appropriate and timely protections and implement safety measures. So for example, companies can hold weekly site coordination meetings to allow for coordination of works to be carried out by different subcontractors and eliminate incompatible works. They can also supplement this practice with daily toolbox meetings by various work teams to allow for work hazards, control measures and precautions, to be shared with workers prior to the commencement of work. So we are also reviewing the coverage of WSH personnel, such as WSH auditors, officers, and coordinators to improve the levels of WSH oversight and champion good workplace safety practices on the ground. But beyond WSH personnel, we encourage companies to leverage technology to detect and prevent workplace accidents. And such technologies can help companies monitor the conditions and practices at workplace more closely, such as installing surveillance cameras at strategic high-risk locations. So in doing so, we may help overcome manpower constraint of site supervision, especially if systems are equipped with video analytics that can provide alerts on unsafe situations, such as when a worker enters a zone that he is not allowed to. So we're therefore considering requiring CCTVs or other means of surveillance to be installed on site in the future. So watch for this. More details will be announced shortly.
So you've mentioned that the fact that deaths and injuries occur to be quite disturbing, but how do you think Singapore can take active steps to protect workers? It's not just the government and the companies who are responsible, right? What can the various other parties, such as consumers even, or dormitory managers, what can they do to supplement what the government is working on and what the companies are expected to do?
Well, certainly, this is a whole of society effort. It's not just the companies, but all of us, play an important role. We've had feedback as well coming from members of the public where they see unsafe working conditions too, in the vicinity, even, for foreign domestic workers, for example, cleaning, windows or high-rise situations. So these are, part and parcel of how I think the public can play an important role. But of course, while inspections and enforcement form a key part of our efforts, I think we have to supplement, some of these efforts, because we do, a lot more enforcements these days, especially for high-risk workplaces, as well as those with poor workplace safety and health performance. So, we don't want just to go around putting fines on companies or people. But I think it's important to frame education and awareness, but at the same time complement it with how we can get members of the public, members of the workforce, the union leaders, for example, and even management to do more ground checks, on the ground engagements, so that we can all make our companies safe. So I think this is really a collaborative effort for all. And at the same time, I think on the part of whistleblowers, we want to assure them as well that all information given to us are kept confidential. Their identities are kept confidential because under the WISH Act as well, employers cannot dismiss or threaten workers who have reported WSH issues. And certainly MOM will protect them and take enforcement actions against those who go against this. So ultimately, there is some level of protection for whistleblowers, but we need all parts of the community, including industry stakeholders, to play their part and go upstream. Hopefully identify many of these risk areas beforehand up front so that we can prevent accidents downstream and certainly keep the workplaces safe and our workers safe.
SMS Zaki, thank you for taking the time today. Zaki Muhammad, Senior Minister of State for Manpower. And in other news, monkeypox patients will now recover at a dedicated isolation facility until they're non-infectious and ready for discharge. The Health Ministry, though, hasn't disclosed where this facility is located. But here's what we know from a ministry statement last night. This isolation facility is for all monkeypox patients who have been assessed by public hospitals as clinically stable. And they'll have round-the-clock telemedicine support at the facility. Previously, confirmed cases were isolated in hospitals. The quarantine period for close contacts is also cut by 7 days to 14 days, followed by 7 days of monitoring for symptoms via phone calls. The US confirms that a drone strike in Kabul over the weekend has killed Al-Qaeda leader Ayman al-Zawahiri. He's the man who helped Osama bin Laden plan the September 11 attacks, which left nearly 3,000 people dead. US President Joe Biden says Zawahiri's death marks a major blow to the terrorist network.
Now, justice has been delivered, and this terrorist leader is no more. People around the world no longer need to fear the vicious and determined killer. The United States continues to demonstrate our resolve and our capacity to defend the American people against those who seek to do us harm.
And those are our top stories. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Chao Suan and see you tomorrow on The Big Story.